How's it going, you guys? So I just finished a grueling workout and I had a lot of thoughts on my mind that I want to share in this video. In this video, I'm going to be discussing LDL, okay? So LDL on a cholesterol panel. So first of all, a lot of people don't actually understand that LDL is not cholesterol. It's not a type of cholesterol. LDL is a lipoprotein, okay? Lipo, meaning fat, meaning lipid, protein, meaning protein. So essentially, what LDL really is, LDL, so first of all, a lot of people, they claim LDL, it plays a causal role in heart disease. It acts as a proxy for heart disease, or is somehow causally linked to heart disease. The fact of the matter is, studies done on heart attack patients in the hospital, they have varying cholesterol levels. There's people with LDL levels varying from 60 all the way to 300. LDL cholesterol does not correlate with heart attacks and heart disease in patients. Studies done on hospital patients hospitalized with heart disease. So people who are hospitalized with heart disease, a lot of them do not have high LDL. In fact, they have LDL in the super low range. That's supposed to be correlated with a zero risk in heart disease, according to vegan advocates like Caldwell Esselstyn, people like them. So that's the first thing, is that so LDL, there's no causal link. There's only correlation studies and mechanistic data, and even that is not very significant. So the next thing, so there's studies done on hibernating animals, okay, animals like bears, and when they're hibernating, their LDL levels rise drastically. Also, humans who fast, just the act of fasting, which typically doctors ask all their patients to fast before getting their blood markers tested anyway. Humans, when they fast, their LDL levels rise significantly as well. Humans who consume low-carb, high-fat diets also have higher LDL. What are some other things that increase LDL in the blood? Exercise will increase your LDL, and also it'll increase your HDL as well. And that's why, generally speaking, it's recommended not to exercise before blood tests. So, if you put this all together, and also there's a blog article from a prominent vegan who had a heart attack. It was called like Vegan RV or something like that. If you're really interested, you can find that on my Instagram under the research highlights on my Instagram. Click on to read the full post, and you'll see even vegans who have perfect blood work. Okay, this vegan had a LDL level of like 69. But their HDL was super low and the triglycerides were high. They basically had blood markers of metabolic syndrome, even though they were not particularly overweight. They had a healthy BMI and everything, but they had a heart attack. And they discovered, well, it's because, their LDL levels might have been perfect, but it's not LDL that drives heart disease. It has to do with insulin resistance and triglycerides and inflammation. And so they changed their diet to actually fix their HDL to triglyceride ratio, and they cared less about the LDL, and they fixed their health and felt way better. Anyway, also, if you look at studies done on, or intervention trials done on low-carb diets, again, I have some of these studies linked on my Instagram page in the highlights tab. And I'll be doing more in-depth posts, I'll do a whole blog post about this in the near future, and probably more videos, even though I've already discussed and reviewed research relating to this topic on my channel before. Low-carb diets, they almost always, even in obese individuals and healthy individuals, and individuals with insulin resistance, they increase HDL. They also increase LDL. They significantly decrease triglycerides. And they also significantly decrease hemoglobin A1C, and fasting insulin. And generally, C-reactive protein goes down, and those, like, there's been hundreds, well, not hundreds, I've seen dozens, absolutely. I've seen at least 20 prominent ketogenic or low-carb dieters who have been on the low-carb or ketogenic diet or a high-fat, high-meat diet for over a decade, and they post their coronary artery calcium scans, and they have coronary artery calcium scans of 0. These are direct scans of coronary artery calcium. Okay, calcium in their coronary artery. And it has been considered the golden standard for heart disease risk, even from the vegan president of the American cardiology. What's his name? Williams. Is it Caldwell Williams? I don't remember. But the president of American College of Cardiology said CAC scans are the golden standard. Low-carb dieters have high LDL, but they also have high HDL, low triglycerides. They have better markers of insulin resistance and metabolic syndrome, and they seem to have effortless fat loss. And on top of that, 0 coronary artery calcium. So vegans used to say that coronary artery calcium was the golden standard for heart disease risk along with LDL. But now they see that these low-carb dieters, they have high LDL off the charts, but they have 0 coronary artery calcium. And so now they're faced with cognitive dissonance where they have to say that the CAC scan must not be that great because their LDL is high, but the CAC scan is like newborn perfect, like brand new arteries. So with all this being said, the first thing you can think of is pretty much everything that increases LDL. It says that LDL is most likely related to energy that the body's utilizing, energy mobilization. So I've been saying this for years now. At least since 2018, I've been very vocal about this. Essentially, LDL, anytime you participate in an activity where there's more body fat being mobilized, and in fact, weight loss can actually increase LDL, especially if you have a significant loss in body fat. If you lose 40 pounds of body fat, typically you'll see an LDL spike of something like 15 to 20%, maybe less than that. Okay, and why do you think that is? Fasting increases LDL. Vigorous exercise increases LDL. Hibernating animals have a higher LDL. Low carb, high fat diets increase LDL. And just increasing your fat intake increases LDL. And going on a low fat vegan diet decreases your LDL. Why do you think that happens? And also, eating more cholesterol in your diet does not increase your LDL. But what does? Eating more saturated fat increases LDL. So what is LDL? Well, LDL is like a boat floating through your bloodstream that carries fat as energy. Anytime fat is being utilized as energy, pretty much all of these situations that increase LDL, what else is happening? They're mobilizing more fat as fuel. And so you'll see an increase in LDL anytime there is greater fat mobilization, whether that's low-carb diets, fasting, vigorous exercise, significant weight loss, you name it. And as I posted before, you could probably search on Google vegan RV heart attack. Going vegan and lowering your LDL down to horrible amounts, under 60, is not going to save you from heart disease. It's just not. As shown by these vegans who have had heart disease. Now, what else can we say about LDL? Well, there's studies that actually show LDL, so studies done on elderly people actually show the healthiest and most longest lived people tend to have greater LDL. A higher LDL level seems to increase or seems to significantly decrease your risk of all-cause mortality. greater longevity, longer life, and greater health is correlated with higher LDL. But I don't really like to emphasize that because it's a correlation, and there's, when you bring that up to the vegans, they claim I think they say it's a reverse causation or something. But with everything being said, I think it's pretty safe to say that LDL is not what people think it is. There's a great book that you can see. This video is not about debunking the cholesterol heart disease myth, but you can check out the book, The Great Cholesterol Myth by Johnny Bowden and Dr. Sinatra. That's a great book. I have it. It is a very basic outline book that just, points out some of the most prominent studies showing it's not LDL that causes heart disease, it's inflammation, it's insulin resistance. You can also, so there's Dave Feldman, who has been doing a lot of experiments with himself and some of his clients he consults with, where they do blood tests and they do different experiments, fasting experiments, exercise experiments, carb experiments. They try out different diet experiments, and they test their blood. And they actually have found that your LDL level goes up and down significantly. It varies by anywhere from 50 to 200 points throughout the day, depending on the activities you do. So, you can check out Dave Feldman's work. I don't emphasize that either because he's not a medical doctor, but he has done some very interesting experiments that give you a greater understanding of what LDL actually is. Another thing, Hong Kong. Okay, sure, they have great health care. They're a pretty wealthy country, I guess, Hong Kong, but they also have had the greatest life expectancy for multiple years in a row, while at the same time also having the highest red meat consumption. They had over 1 pound per person per day was a red meat consumption. I think it was mostly from pork. And they also had a life expectancy for men of something like 85 years old. And I believe this was from 2016, 2017, 2018, roughly speaking. So sure, they have they have great healthcare, but other countries that have great healthcare and high meat intake, they don't have the same longevity. So the point is, regardless of healthcare status, if a country can have the highest red meat intake, 1 pound of meat per person per day, and also have the highest life expectancy, that means that red meat there's probably more to it than red meat. America has great healthcare, I guess. They also have a high meat consumption, do they? But the difference is, well, what do they eat along with the meat? It's healthy user bias, really. Anyway, I don't want to get too deep in all that. What I just said is very nuanced, and it requires a deeper conversation. So, hopefully you got the gist of what I'm trying to say here. Leave your questions and comments down below. LDL is about energy mobilization. It's like a boat that floats through the bloodstream and carries nutrients and fat and triglycerides and energy. It is not there's no, give me intervention trial or something that shows a causal relationship. Not a giant meta-analysis of 1 million people that's been cherry-picked by the statin drug companies, okay? That's the only thing that people send me when I ask for something that points a causal link towards LDL and heart disease. There's really nothing that shows a causal link through heart disease. In fact, the Framingham study actually showed, so when they followed up the Framingham study in 2011, they actually found people with the greatest, people that have the highest HDL actually have the lowest risk of heart disease, and it's irrelevant of LDL. I have the data in the study, again, linked to my highlight section on my Instagram, so go and check that out. Anyway, and your triglycerides are low, HDL is high, it doesn't really matter about your LDL level because it matters in the context of insulin resistance and how your body is metabolizing sugar and fats. So anyway, post your comments down below. Talk to you guys next time.